Okay, pregnancy and chiropractic. Real talk about feeling good and preparing for birth. You've probably been lied to during your pregnancy at some point, that ache you feel in your back, the pressure in your hips, the exhaustion that hits you like a truck at 2 p.m. Everybody says it's normal and it's not. And there's definitely a way to feel good during pregnancy and stay connected to your body and actually enjoy your pregnancy.
I am Dr. Whitney, and along with Dr. Caitlin, we help hundreds of women through the mess, the magic, and the muscle aches of pregnancy using nervous system focused chiropractic care that's safe, gentle, and incredibly effective. In this video, we're going to give you some real talk on what's happening to your body, how to support you naturally, and how to prepare for birth without guesswork.
Okay, if you've ever thought, is this supposed to hurt this much? Or I feel off and I just don't know why, you're probably about to get some answers that you've never been given to and solutions that could definitely change everything for you. Dr. Whitney's going to tell you a little bit about a patient, Tiana's experience here.
So Tiana was 38 weeks pregnant and she had gone to her OB and they had told her that baby was breech. She was very concerned. She was not ready to have a C-section. And so while we absolutely do not consider ourselves baby turners, Tiana came to us. She has been a patient for years and we told her that like, hey, let's get your body ready for this labor and delivery. Let's get you adjusted a few times a week, and then let's see what happens when you go to your OB the next time. So we got her adjusted a few times that week. She went back to OB. Baby was head down. She had the baby the next week. She delivered naturally, and she did not have to have a C-section.
Okay, so here's what's really going on inside your body during this time. So, not only your spine is moving, we've got increased curve because you are growing a baby, so you're getting bigger in the front, which causes more of that lordosis in the back. But then your ligaments are loosening because of relaxin. So much fun. It loosens your ligaments and muscles, which makes things kind of more unstable and fight against us a little bit more. Your pelvis is shifting because obviously it's got to fit a whole baby through there. That's the goal anyway. And then postural changes because your center of gravity starts to shift a little bit. And so that's when we start, standing funny, popping our hip out, doing all the things that we're not supposed to do in order to try to stay comfortable. Um, Now stack that on top of everything else that's going on. You're getting less sleep, you have higher stress, your digestion is changing. You possibly have a very wiggly baby kicking you from the inside out. That's a lot for one body to manage on top of, you're probably managing other things at home. It's no wonder that your body might be going through it and hurting a little bit, but pain isn't the only issue. All of that physical change also affects your nervous system because your nervous system does run everything. It's in charge of everything from your digestion to your sleep to your hormones to your mood, which is why it's so important with nervous system based chiropractic care that we make sure all of that is in check.
So your nervous system and pregnancy superpower. So this is where chiropractic comes in. We're not talking like the pop and pray type of chiropractic. We're talking about pregnancy specific nervous system based care designed to remove stress, balance your body, and help your brain and body talk clearly and correctly. So what does this actually help with? We help with things like back pain and sciatica, round ligament pain. Everyone talks about round ligament pain, and it is not a good time. Rib flare and shortness of breath. So baby's going to be up in your ribs. That's super uncomfortable. You don't feel like you can take a deep breath, like especially towards the end there. Headaches and jaw tension, constipation and heartburn, and baby positioning, like we talked about previously, trying to avoid a breech presentation. And then also labor prep. Yes, we can help you have an easier, faster labor. We are going to talk about that a little bit later.
Okay, so one thing that we hear all the time though is it safe? Yes, it is 1,000 times yes, 100% safe as long as you are going to a provider that is trained in prenatal care, like we are. We also use not only very gentle adjustments with that Webster technique. But we also have things specifically in the office for pregnant moms, like these pillows that you can see in the picture in order to hold and support your belly. Some other myths that we just want to talk about too is that chiropractic care is safe, but also pain just doesn't have to be a part of your pregnancy. I'd say that we both had fairly painless pregnancies, maybe not so much at the very end, but I do think we contribute that a lot to getting adjusted regularly.
How chiropractic supports pregnancy and labor. So, research shows that women under chiropractic care experience a 39% shorter labor. That is a little bit less percentage when it comes to first-time moms. Obviously, your body hasn't been through this before, but that's not a typo because when your pelvis is balanced and your nervous system is regulated, your body can move through the stages of labor and delivery with no roadblocks. No stalled dilation, no baby's head stuck in on one side, no something isn't progressing type of mystery. And when baby arrives, that is not the end of the story. So postpartum can be a little crazy. So that's when you've got the long nights, sore shoulders, breastfeeding posture, your hormone shifts hit full force. Chiropractic care isn't just for pregnancy, it's for the entire journey. We help with postpartum healing, nervous system recovery, and even baby's last latch and digestion if they need a little support too. So we absolutely love to see babies right after birth as well because they do go through trauma through the birth canal as well.
Okay, so it doesn't always mean that it's easy. It doesn't always mean that your body is prepared to do what it's supposed to do. So we really encourage all of our moms that come in to really build your pregnancy dream team. Obviously, us with chiropractic, but then we also recommend pelvic floor physical therapists, doulas, midwives, or midwife floors at hospitals, and then birth and prenatal classes. Here it shows some lists of not only some people that we recommend to patients, but people we've also used personally and really trust.
So, how to start your chiropractic journey? Find a specialist. So, we highly, highly, highly recommend finding a Webster certified prenatal chiropractor. That is us in the Altoona and Des Moines area. Both Dr. Caitlin and I are Webster certified and work with a ton of pregnant moms. We do recommend that you start early. So, it is the best if you can start in that first trimester for maximum benefit, but it is never too late. So if you are 38 weeks pregnant and you want to be seen if you're in pain or if you want to prepare for your delivery, you are always welcome in. And then for regular care, we do recommend that most moms be seen at least weekly for best results. If you come in with some specific pain, we might recommend a little bit more frequently at first to make sure that we address those pain issues and then get you to a more wellness type of care for your pregnancy. So your next step, book your prenatal consultation with us online. We'd love to have you. DM us your pregnancy struggles. Follow us on Instagram at Access Chiro for tips and real talk.
Thanks for listening today. Now, here is the big challenge for a lot of moms. Most women don't even know this care exists, so definitely share this webinar with your friends. But also don't forget that it's not too expensive, it's not too late, it's not too weird, it's not whatever hesitation that you're having. A lot of the times you just don't know until you know. So definitely reach out to us with any questions you have, like Dr. Whitney talked about. You don't need to suffer quietly. You don't need to wait until your next OB visit to say, like, I'm just really uncomfortable. I've been told to hang in there. You can definitely do something about it now. So whether you're 8 weeks or 28 weeks or overdue and walking circles in Target, chiropractic care can help you feel more like yourself again. So if you're in Altoona or Des Moines, we'd love to be part of your support team, your dream team, like we talked about earlier. We are moms, so we do get it. We've been there and we'd be honored to help you. So thank you
Thank you
very
for
much.
listening.